Welcome, I'm Neil Crump. I'm one of the co-founders of BOB.health. We are a startup, and we are here with a panel of five additional startups and SMEs who are here to share their story about how they are successfully navigating through the NHS. We also have a wonderful speaker, Clíodhna, who is from the Accelerated Access Consortium, and I'll explain what her role will be, and she'll be talking to us about the innovation service. We are obviously in the age of social media, so just to run through, the hashtag for Giant is hashtag Giant2020. This track, the hashtag is hashtag unpack the how, and Bob's Twitter account is BOB.health, so Bob.health with dots spelled out. So we were just going to run a poll just to get a sense of who our audience is. So there's, if you look to the right, look to the right of the screen where it says chat, there's also something that says polls. So we were just wanting to find out what type of organisation you worked for. So the options were SMEs, large commercial organisation, academia, where you also might be a student, NHS or affiliated organisation, social care organisation, a charity, or other. So if I could really encourage everybody on the who's listening in to press on that poll. We've had low participation in the polls, so it's please go across and give that a click, and we'll report back slightly later. As I said, we've got the panel of SMEs, and I'll come back and introduce them all after Clíodhna gives her presentation. So Clíodhna is the strategy and policy manager for who works within the Accelerated Access Collaborative. I said consortium earlier, I think, so I apologise for that error, which is part of NHS England and NHS Improvement. They are working on this really great initiative that I learnt about actually a year ago today. I think I learnt about it at Giant last year, and I wanted to invite them along because I've been to a couple of their workshops. They're a really amazing team. They've really been trying to understand the NHS and how SMEs navigate the system and connecting with the NHS. So I will hand over to her to basically give us her presentation. Now she has slides. Now she doesn't have control of the slides, so she'll be telling the tech team to advance them. So over to you.
Thanks a million, Neil, for those really kind words. So if we can move on to slide 2, that's probably the best place to begin. So just going back to the hashtag of unpack the how and why I am here today. You know, I and the rest of the team, we're in working through how we can best support innovators, be they from a clinical background, industry, academia, patients or carers with an idea themselves. We speak to them regularly, sometimes on a weekly basis. And the specific goal of the work that we're doing on the innovation service is really making that heavy lifting, which many SMEs have to go through right now, a little bit lighter. And I'm really excited to talk a bit about how we plan to do that, and maybe even have some people here who will help us work that up further. So first of all, to explain a bit about the Accelerated Access Collaborative. So it's a unique partnership between different patient groups, government bodies, industry and the NHS, with the purpose of getting the best new treatments to patients faster. So there is a team who supports the AAC, which is based at NHS England and NHS Improvement, which is kind of like the engine force behind all those great ideas and the vision. And developing a single front door to the innovation ecosystem is one of those key 6 visions, which was agreed and stated last summer and requested by the Secretary of State for Health. So what is that vision? If we could move to slide 3, please. So the vision for the innovation service is that it will be a go-to place for innovators to navigate the path to market, and also coordinate the different organizational partners who have a role in supporting innovators in accelerating the best products to patients, to staff to use, for people to benefit from. And you'll be wondering, why do we have a photograph here of a corridor with so many doors opening out from it? And we think it's actually quite a germane metaphor for a lot of what we're trying to do. So a lot of existing resources are up online, and there's also lots of different support organizations who you can access online or access through other routes. We're not planning to duplicate anything, but rather have one place where you can go to figure out what information do I as an innovator need, and then go to that right door, knock on that door, open that door, and get it easily. And equally, speaking to the right organization who is appropriate for where you are in your development journey and can give you the right support. So what does that actually mean in practice, and what is this going to look like? If we can move on to slide 4, which is how this will help innovators. So there's going to be 2 different parts to the service. The first one is providing information, and the second is the transactional part, where you speak to somebody on the other side. So a couple of key themes on the informational part, which I'll speak to, and issues that that's addressing. We hear very frequently from innovators that they want to understand what the NHS's needs are, so that they go and develop things which are genuinely in demand, which people actually will want to use and benefit from, which speaks to an issue which we've identified over the last couple of years, that we weren't making this clear enough, or as clear as should be. Understanding regulatory requirements, understanding how to build up an evidence base is also of significant importance to innovators for obvious reasons. And then another area is supporting innovators to understand more fully how to gain adoption and spread by understanding the different processes to do procurement, reimbursement, and commercialization. As things currently are quite complex, there's many different avenues, having a better grip of what's the right approach will be very useful. So that's the first side, the informational side. And then there's the transactional side, which is helping an innovator register, submit information about their innovation, and connecting them with the different support organizations so that they will benefit by only having to tell their story once in order to get support. Having that two-way interaction with one record of the conversations that were had, so that, you know, everybody's on the same page. And that as you make more progress and you say, you know, get your regulatory sign-off, you're able to then get more support. And it's all been on that one record rather than having to go elsewhere to go and get more of that support. So if we can move on to the next slide, how this will help innovators 2 of 2. This is a bit of an outline of how the transactional side will work. So by providing one single view of the innovations registered, it will enable more joined up early stage support. And here's some of the different organizations who have a role in that. Better coordination on topic selection for health technology assessments, which are done for evaluating the cost effectiveness of different innovations. And finally, quicker spread, scale, and indeed export of proven innovations. And running parallel to all these streams, for organizations like NHS Supply Chain to have a forward view of the pipeline so that they can plan getting the innovations which are most in need onto their category towers. I think it's really important to actually give a shout out to these different organizations who've been working with very closely, in many cases, on developing this project. Again, harkening back to the collaborative in the AAC. So if we can move on to the slide 6. So what will innovators get? You probably want to have some insight as to what this is going to look like. So here's a couple of screenshots of the prototype, early prototype, I must add. But then innovators will get a site which provides a trustworthy brand with a clear value proposition. So they know that they're in the right place to get information and they can trust it. That they can segment the information, get only that that's relevant to them. And if you move on to the second slide on this, that innovators will have one single view of the progress that they made with their innovation and their correspondence with different support organizations, giving them advice, giving them support. And that they can get support that's appropriate for their stage of maturity. So whether like you really are starting out with something very early or whether you're really close to finishing off, this can help you, and it can help you on all the steps in between as well. So this second last slide is timeline. If we can move to that one. You can see now that we are nearing the end of our alpha user research journey, which I guess, as you might expect for a project of this ambition, has required quite a lot of time to develop. And we are planning to go into what's called a government digital services assessment, where they basically approve whether our innovation of this service is fit for purpose and can move on or not. We're planning to then progress the build for this with further user testing in January to June next year. with a view of going live in summer next year, 2021. And for those who are interested in finding out more, if we can move to slide 9, we have provided some links here, contacts to both the team and also to the Accelerated Access Collaborative. And we're always keen to make sure that we have as wide a representation of innovators participating in user research. Like we want this to work for all people. We want to hear from all people. And we've provided a form here, which I'm sure the BOB team will send out again to all who are interested to make sure that you're able to participate should you wish.
That is fantastic. Thank you very much. So I think, you know, as an SME, I think when I first heard about this service, I thought, oh God, wouldn't it be great if we can access that now? But obviously it takes time to build and create this. And I do think the team have done a great job of consulting across the board with all sorts of organisations that they're going to have to connect up with, also a whole load of SMEs. And actually in the chat, we have dropped the links that were on that slide. So if you are interested in beta testing and user testing and all that work, the link is there. So you can copy paste that out. Please do go and contribute. Obviously, the more we all contribute as SMEs, the better. The poll result is about 13% of our audience comes from a large organisation, and all the rest are from an SME. So we really are here talking to our fellow SMEs. So let's bear that in mind in our answers, but that's what we're passing on to the knowledge to other SMEs. So the first thing I want to do is therefore turn to our panel. So Clíodhna will come back later on in the discussion, and obviously because they've done so much research into the environment, that's why I think she can probably provide us with a nice roundup at the end, because she's got a huge insight into the way all of us have been navigating the system. So I'll turn now to our panel. We have a full house, I'm pleased to see. Everyone has made it through the lobby into the key team. So we have 6 SMEs with us. We have a number of them. So what I'm going to do is, rather than me introduce them, I'm going to ask themselves to introduce themselves, tell us what company they're from, and to give us that all-important 1-minute elevator pitch, which if you're in an SME, everyone's like, you've got to have your elevator pitch. So if I can move through the panel, just asking them to give their 1-minute elevator pitch, and then we'll come back for a round of questions. So to kick us off, Zain, would you like to introduce yourself in full? Remember to unmute your line. Introduce yourself in full and give us your elevator pitch. What's Mynurva all about?
Good morning. Thank you for having us. It's a real pleasure to be here. So yes, my name is Zain. I'm a GP by background and digital health entrepreneur. I'm running Mynurva, which offers fast access to therapy via live video securely, confidentially and discreetly. And I'm here today to talk about what we're doing in the NHS and how in 2014, the government, UK government, has said that by 2020, by now, 75% of people being referred by their GP with mental health problems, so that's depression, anxiety, low mood, would be treated within 6 weeks. Obviously, we know that's not happening. Over half have been waiting 12 weeks. And I'm glad to say that we're starting to work in Cornwall, where over 200,000 people are able to self-refer to our service and see a therapist the same day for psychological therapy, which is completely transforming the way mental health services are being delivered in the NHS across the UK. That's
amazing. Thank you very much, Zain. So now we'll turn to Dr. Rayna Patel, who is from BOB.health. So what's your role at BOB.health? Remember to come off mute, and Rayna, and tell us all your elevator pitch.
Great, thanks, Neil. Lovely to be here. I'm Rayna, I'm from BOB.health. I'm CEO and co-founder at BOB.health, but a medical also by background. And what we do at BOB.health is really combine behavioural science with AI to improve the quality of life of cancer patients. So supporting them to self-manage, to track and understand and optimise their care through really highly personalised patient support, as well as to communicate crucial information back to their care team. And through the platform, we collect really rich real-world and patient-reported data that represents the voice of patients in healthcare delivery and also in research and drug development.
Amazing. Thank you, Rayna. Dr. Patel. So this is Rayna is our third doctor. We're now turning to our third doctor. So Daf, please introduce yourself. Daf is in fact a surgeon. So Daf, please introduce yourself.
Thanks, Neil, and good morning all. So Concentric is a digital consent and shared decision-making application which transforms the paper process of giving consent for a procedure or treatment. So I'm Dafydd Loughran, a surgeon by training and now Chief Exec at Concentric Health. And our mission is to transform how decisions are made about our health. Decisions informed by patient outcomes and shared by patient and clinician. And Concentric is now used internationally, including at sites such as Imperial College Healthcare and Chelsea Westminster Hospital, NHS Trusts, and on the island of Jersey. So the traditional consent process, often using blank carbon copy forms, is a poor experience for both patient and clinician. It leads to errors, medical legal risk. It doesn't support patients to make decisions around what matters to them, and is increasingly incompatible with post-COVID healthcare. Remote consent functionality is supporting our partners to keep operating safely this winter, removing the need for risky in-person consent consultations in the run-up to surgery. Our digital consent application is the best in its class, intuitive, integrated, and trusted, and it supports patients and clinicians to make informed, shared decisions. Thanks.
That's fantastic. And I'll just flag that Concentric actually have, they're one of the first two companies to actually have a sponsored story on our BOB platform. So they have a story about the implementation of Concentric in Jersey. Their Jersey run a sandbox set up within their healthcare system for digital health. And he was able to deliver a really successful implementation there. So well done on that implementation, and the stories there that you can go and read about and learn about how you might implement Concentric in your local system. So our fourth doctor is Dr. Paul Rinne. I think I've pronounced that right. Correct me if I'm wrong. So if you can come off mute, Paul, and tell us all about Gripable.
Morning, thank you for having me. So yes, Dr. Paul Rinne, but not to worry at all. CEO and co-founder of Gripable. At Gripable, we develop smart mobile objects for physical therapy, so devices such as Gripable that track and train specific movements that therapists would be working with their patients. The devices link then to mobile systems, and the apps can be downloaded then on tablets, smartphones, and then transitioned from the clinical environment to the bedside and then to home. We are early stage in our development. We launched earlier this summer, and we now have about 400 systems out in the real world across about 100 sites, about 50% NHS, 50% private, and a number of European territories as well.
Amazing, thank you, Dr. Rinne. Sorry, I had clarified with you how to pronounce that weeks ago, so I do apologise. And then on to our fifth doctor, so Dr. Lucy Mackillop. If you can unmute your line and tell us all about Sensyne Health.
Thanks, Neil. So yes, my name is Lucy Mackillop. I'm a practicing clinician. I'm an obstetric physician at the John Radcliffe in Oxford, but I'm also Chief Medical Officer at Sensyne Health. And Sensyne Health is a clinical AI healthcare company with a unique business model. So we work in true partnership with the NHS, and that is our business model. And be that with clinicians to develop software products, applications, or algorithms to improve patient care, or with our partner trusts with whom we have a strategic research agreement, and with those trusts, we analyse fully anonymised health data to provide insights for life sciences industries. So in that way, we work between life sciences companies and the NHS to drive innovation and discovery science, and to the benefit of all those involved. And indeed, the NHS has a 12% equity share in Sensyne Health. So we really mean it when we say we're working in true partnership.
Amazing, thank you very much. So last but not least is a fellow non-doctor. I'm not a doctor either, but we do have Victoria Smith here, but she is, I believe, a clinician. And she can, well, no, she's not a clinician, she's worked in procurement. So I'll pass you on to Victoria Smith to talk to you about what she does and what Jamf does.
Thank you. Yes, no, I'm not a clinician, I'm afraid. not as clever as these guys. So my name is Victoria Smith. I've worked in the NHS for the last 14 years as a procurement manager. I moved to work for Jamf 6 months ago when Jamf decided that they wanted to focus more on healthcare. So Jamf is an organisation that is worldwide that supports organisations and helps them succeed with Apple products. Jamf helps manage them, and it also has its own solutions that help put the patient first. Amazing.
Thank you so much, Victoria. There's not all of us can be clinicians. I was once a microbiologist, so that's my one that moved away quickly from that. Anyway, we won't talk about that now. We've got other things to talk about. So just also to let you know, we've dropped everyone's contact details in the chat. So if there's anyone of the panel here that you want to reach out to, then please, you've got their contact details there. Obviously, you can connect with them through the functionality of Giant, but you can directly send them an email. So if you're interested in talking, they'd love to hear from you, and we'll hear what they might need help with as they look to spread and scale in a few minutes. So we've had the elevator pitch. Thank you so much for everyone being so concise and being really clear. So hopefully our audience understands what it is that you do. So the next thing I wanted to cover, and I'm going to go around, we're going to go around in that nice same pattern. So leading with Zain, and just ask you, what's been the focus of your adoption strategy when it comes to Mynurva? And have you made any adaptations along the way as you've been implementing? Has there been any changes so far? There may not have been, but so adoption strategy and any adaptations along the way.
Is that specific to the NHS?
Yes.
Yeah. So I think our strategy really has been really working closely with our partners in Cornwall and starting by understanding the need. We spent a lot of time, several months, really understanding what the need was, where we need to be, working with all the stakeholders. So that's the GPs, the commissioning board, the patients, and the therapists, of course, and really understanding, what kind of service we needed to be delivering in terms of aligning all our processes. And so, that really helped, because when we finally launched live, having been through all the hurdles and the necessary things, we were meant to launch with 3 or 4 practices referring their patients, but I think now it's almost 30 in just 2 months. And the success, my view, the critical success factor for that was working closely with the people that matter, and the people who, at the end of the day, we're trying to serve and provide a good service for. And so what was really clear to them was that we needed to be able to provide a same-day service. And if we could do that as seamlessly as possible, reducing GP time, which was where the self-referral came in, and making it as seamless as possible using the technology that we'd already built, then that was going to be what was important. And obviously, backed by that, we're doing a proper economic evaluation as well, because as we all know, that type of data matters. So I think the fact that we're taking it seriously in that manner, and we're backing it with University of Plymouth doing that economic evaluation, when people see what we're doing, they say, okay, like was mentioned by the doctor from Sensyne Health, working in collaboration with the NHS, they can see, well, actually, these guys are not some scary company that are just trying to destroy what we all love, but actually led really well and trying to make things better for everybody.
Yeah, I mean, obviously, a same-day service is astonishing to access services which the NHS are paying for any service other than maybe A&E that you can walk straight into. But what's the comparison in terms of what would be the average wait for someone before your service was in place?
So, I mean, obviously, I won't say specifics about Cornwall. I mean, they're very forward-thinking as a county and an organisation. But I mean, we know half of referrals into the NHS therapy services is 12 weeks. The wait time. Okay. 3 months. 1 in 10 still waiting a year, and 13% still waiting for a first assessment. And this is pre-COVID data.
Yeah.
With COVID, obviously that has changed everything and made things a lot worse. So pre-COVID, it was bad. We know now it's worse. But hopefully, we can look to go beyond Cornwall. But I think that engagement piece is difficult, and I think all the other companies here would no doubt agree that it's something that we're all needing help in and working on.
Okay, well, I think it's a phenomenal, that's a real transformation for people. I think,
Thank you.
Important. So well done. So Dr. Patel, Rayna, make sure you come off mute, and would you like to tell us about your adoption strategy and any adaptations you've made along the way?
Thanks. Yeah, of course. I would echo a lot of what's just been said around really understanding the value across stakeholders. And there's just no getting around in the NHS that you do have at least 3 very different stakeholders with very different needs. And actually, unless you cater not necessarily equally, but have them all in mind when you're developing a product, it can fail on any one of those stakeholders, whether it's service managers, whether it's clinicians, or whether it's patients. And I guess for us, one particular feature was patient engagement. We knew that clinicians had fed enough into our tool that they could get value out of it, that they were seeing value in consultations from having the kind of data that we can give them. But where the real gap is in our space in collecting patient-reported data and in delivering patient support is often just whether patients will use a tool, whether they are comfortable with using technology, whether it's applied in the right way or designed in the right way or caters to people who are sight impaired or have neuropathy. And so for us, one particular adaptation in our adoption strategy there was to really build that credibility and trust with the patient community. And for us, that meant, whilst we were also still working with NHS trusts, going really to the patient advocacy space and to charities, and working with organisations like Macmillan and Bowel Cancer UK and Sarcoma UK and CR UK to say, what do people want in these communities? What's the gap in how support is currently provided? And build up trust in a way that they are familiar with and routes that they're familiar with. And so that was a key adaptation to our strategy that we went through and really helped us understand what patient needs were in that space as well.
That's amazing, and I believe you have a sort of pared down version of your application on the App Store. Is that right?
Yeah, absolutely. It was a way for us to just get the app out, even if it's in a basic form, to as many patients as possible, get their feedback, and use that to build better features and more specific features for when we work with particular NHS services. But we've had several thousand patients use the app for going on a year now, and use it very consistently, which dispels some of those myths around the fact that patients won't use technology for the long term. If it provides a use case for them, and if it provides value day to day, I think they really will.
That's amazing. So well done. I think that's tremendous. And I also understand you have a life science strategy. So you're in the cohort of Novartis's Biome program. Is there anything you want to, I think you're the only one who's been on a program like that. Anything you want to pass on to our SME audience about getting into those sorts of programs and what you think the benefits might be for you?
Getting into the programming, I'd say it's much like any other. You just have to understand what that particular organization is looking for. And for us, it's not that different actually to what a lot of academics or clinical academics are looking for, which is better understanding of their patient cohorts around which they can organise better services, and in this case, develop better drugs. And for us, the patient-reported data that you might need to deliver a better service is actually very similar to that you might need to demonstrate quality of life outcomes associated with your drug. So, again, it's the same message, just really understanding what they need. And there's no substitute for talking to as many people as you can and trying to understand what are the daily difficulties, what are the things that prevent them doing their job, what are the things that are a pain for them. And for life science companies, that was sending out paper surveys, getting, by the end of a clinical trial, getting 5-6% back, transcribing them manually into spreadsheets. Those things take a huge amount of effort and resource, and are not particularly patient friendly. So, replacing all of that and automating it and making it appealing to patients is really appealing to them.
That's amazing. So thank you very much. So Daf, make sure you come off mute. Just to obviously, I mentioned that you've got your implementation story on Bob around Jersey. So any other implementation stuff that you want to share with us and any adaptations you've made along the way?
Yeah, so I wanted to just reflect on a couple of other deployments actually. So in terms of that adoption strategy, and in particular spread within a trust, I think it's been interesting to contrast our deployments at Imperial and Chelsea Westminster. So at Imperial, clinicians across the specialties were given permission to use Concentric initially optionally, but we manage user accounts, help get clinicians started and all those kind of stuff internally, almost exclusively within founders. Whereas at Chelsea, the deployment has been managed by their innovation team, who have been amazing, been really engaged, hundreds of WhatsApp messages, almost daily chats about something or other. So at Imperial, we saw slower initial growth, which felt kind of painfully slow for a while. With clinicians, for example, getting started after a corridor conversation with a current user, often early adopter to early adopter, but across different specialties. Then over the past few weeks and months, we've seen increasingly rapid uptake. That's around 20% week-on-week growth currently, as each of those small nucleuses grows out. So in contrast, Chelsea's been rolled out specialty by specialty. So we've seen increased use in blocks, using go-live dates, changes in expected defaults across pathways, etc. And I think we've learned different things from the two approaches, so both in terms of product market fit and in terms of deployment. So in terms of product market fit, it's been great to see organic growth at Imperial, answering the question for us, without anyone telling clinicians they needed to make a change, would they? And it also meant that we were really close to these users and heard directly from them about any niggles that they were coming up against. But there have clearly been challenges too. Initially, many of those clinicians were flying solo within their department using Concentric, without the support of others to learn together. And any of those differences in processes lead to friction in the system, most commonly in terms of theatre processes in this example. So at Chelsea, those examples, those challenges were less obvious, and it's clearly more akin to the deployments we will plan from now on, and our current corner deployment is very much mirroring the Chelsea approach. It is noticeable, though, that we've learned less from clinicians directly, contacting us, responding with feedback, probably reflecting that difference in how personally invested they were in deciding to start using Concentric. So I think flexibility of adoption strategy is important, certainly initially. And there are probably different lessons that you can learn from each approach.
That's amazing. I watched your video that you've done on the product, and I mean, when you look at how extensive and useful and user-friendly it is, and how much information you're able to transmit to a patient around consent, I don't know how you would have. I don't know how that is done on a paper basis, because when you look at how much the quality of what the patient is now receiving is phenomenal. So really well done, because I think I can really, just looking at the video and the demo, you think, wow, as a patient that would be such a better experience. I mean, it's pretty great for the clinicians, but from a patient perspective, going into something really genuinely understand it I think is really so important. So well done on that. So over to our Dr. Rinne at Gripable. How about you? Adoption strategy, any adaptations you would like to share?
Yeah, absolutely. Thanks. So obviously echoing everyone before about user engagement, from the off. So we actually were founded whilst at Imperial College. So we had a lot of access early on in the sort of prototyping phase, especially because we have a physical product. And it's something you need to get into people's hands. So that, of course, is a longer lead time for us in getting that feedback and getting those products out to individuals. But that, of course, we've been going for sort of 7 years with user feedback, and I don't think that will ever stop. It's a maturation thing, it's an iteration thing, it's a constant improvement side of it for the adoption strategy. Then in terms of sort of transitioning from, getting that initial feedback and getting the product correct, the real sort of barrier we came, against and looking at the market as it stood, there are plenty of other companies developing technologies for physical therapy. Yet, if you look, none have been mass adopted. You've got sort of robotics, imaging systems, large workstations. And of course, at Imperial, we had a lot of those in research. But as soon as you went into the real world and you spoke to the clinicians, the therapists, actually very few of that, well, almost none, especially in the NHS, translate into that space. So for us, it was about finding a way of not going top down with, oh, here's this wonderful technology. Listen, the engineers have spent years developing it. It must be adopted. Actually, it was going bottom up and going, what's the current clinical pathway? And can we build something that fits into that pathway that exists already? And counterintuitively, you know, doing startup pitches, one of my first, lines is, we don't disrupt. We disrupt nothing. We come in and we go, this is the thing you're used to. Here's a better way of doing it incrementally. And it actually just fits into your day-to-day. Now, of course, then we build on top of that and go, well, now it can be left with the individual by themselves. It can be transitioned to the home, a pathway that doesn't exist. But getting that initial pathway is the critical part for us. And then in terms of now transitioning from, let's say, that sort of commercial prototype into now a full commercial product, the things that we've had to adapt around are now around procurement. And again, initially, our strategy is very bottom up as opposed to top down. So we're not going into the procurement system, large CCG conversations. We are actually just approaching en masse the therapists that have a certain budget that they're able to work with, and we fit into that budget, again, fitting into their current pathway. And as a result, we're getting hundreds of units out into multiple sites, as opposed to having to target large individual chunks, if that makes sense.
Yeah, that's amazing. So you have a kind of a trial first model.
That's right, yeah.
Excellent. So I think that's a really interesting concept. I think the trial first model, I think that's really, really, really interesting. So well done on, obviously you said, you launched properly in summer, and you've really, you're telling me some of the numbers, you're really accelerating through and really getting your product out there. So really well done on that. So now we will turn to Lucy. So if you come off mute, and if you'd like to tell us about how you're tackling adoption and any adaptations to your implementation.
Thank you. Thanks, Neil. So our adoption strategy is to focus on the NHS first. We do have an international presence, but our focus is on the NHS and acute care trust. And in particular, our lead product, BOB.health, is for pregnant women, so maternity services. And a bit like other speakers have already talked about, I can't emphasize more the importance of engaging clinicians to understand how they work and to make sure that they can see the benefit, be it in better clinical care or operational efficiency of the use of the technology. And so we said it already before, bottom-up approach really does work and is really, really important for success. I think also we have spent quite a lot of time, and it's important to us to develop a proper evidence base. So again, as other speakers have said, we've been working with the University of Oxford to develop sort of credible evidence and high quality evidence for our products, and this relentless pursuit of great UX, so that so there is a frictionless use of the technology for both clinicians and patients. And then supporting our clinicians in the implementation process to make, again, that frictionless transition towards using the product in daily practice. And I guess our sort of adaptation we've seen with obviously COVID, that's been an accelerant in terms of remote patient monitoring, which is one of our strengths. And we've had to rapidly help trusts get up and running with remote patient monitoring very quickly, and also implement that remotely. So our implementation and training strategy has had to become remote in itself. So that has been a sort of a learning process for us, but it's worked very well. And BOB.health is now in just under 50% of all maternity trusts in England as of November, compared to 16 in February. So it really has been hugely adopted very, very quickly over this last 6 months.
Amazing. So, well, congratulations on the great traction you're getting, and also congratulations for that beautiful chair that you have in the background. I think we're all a little bit envious of it. It's very, very nice. So thank you very much. So Victoria at Jamf, make sure you come off mute. You have. So your adoption strategy and implementation, how's it going?
Well, we're in a kind of slightly different position. So we're a worldwide organisation, like I said earlier, and I was brought in about 6 months ago to understand healthcare in Europe. And just to echo again what everybody has said, you've all got really good points, and I think we've all adopted parts of those strategies at some point. From a procurement perspective, because that was what I did before I joined Jamf, understanding routes to market was really important. And I think, you know, in Jamf, we're really lucky. We have a number of resellers that are on framework, so the route to market is potentially easier. However, coming from the NHS, and just to touch again on what Lucy said, and it's something we always used to say, is that actually our decisions come from our clinicians. You know, our clinicians are the people that are going to use the technology. They're the people that are going to be having to do this day after day. So whatever our clinicians want is what we should be able to provide, and make it as simple and as easy as possible. Clinical time is so important, and it is so relevant to ensure that they adopt whatever solution they're going to take. So it only echoes what everybody else has already said. But as Jamf, as a company, we have a healthcare strategy that stands. But obviously with COVID, again, it was accelerated, and a new solution called virtual visits was born in response to COVID. I was really lucky. There is a story on BOB.health from Oxford Health, so I was really lucky to see that play out. And again, it was the adoption of the patients and the staff that obviously made it work.
Yeah. So yes, there is a story on the platform from one of the team at Oxford Health talking about how they implemented Jamf at a ward level. So there is a story that people can go and read there. So thank you very much, Victoria. And obviously, you with your procurement hat on, you come at this from quite a different angle to the others. So thank you for sort of bringing that to the fore and explaining that to people. That's really fab. Now, we just wanted to have a moment to I'd asked everybody in preparation for this if there were any particular organisations who'd been wonderful to them on the journey that they sort of stood out to them. So I'm going to prompt two people, and if any other of you want to bundle in, then please just raise your hand and I'll pull you into the chat. But we'll progress through this quickly as we have the bit of the full start, which is eating into our time. But Zain, Curno Health have been amazing. So who are Curno Health, and what do you want to say about them?
So Curno Health, Curno is the Cornish word for Cornwall. And they were established by all the GPs in Cornwall, who have all grouped together as a kind of almost like it sounds like in Jersey, a digital test bed to enable different companies or different organizations to engage with the services in Cornwall, whatever they may be, and just provide a kind of a less of a bureaucratic place to start. Obviously, it still takes time and a lot of patience is required, as with anything in the NHS, because you've got to do things properly. But definitely, I mean, probably like most of the founders here, I've been across the country engaging with various people, but with them, with Curno Health, especially Ollie Sleeman, who's now left, but now Gary Jennings and Tessa, who've been wonderful to work with. So a big shout out to them. Obviously, I don't think they take all projects, but yeah, they're definitely trying to bring a breath of fresh air to the way in which, innovations can be brought to the people that need it.
That's amazing. I mean, when you find with all of us here as people on this journey to sort of navigate the NHS, when you get that organisation that really gets you, understands you, when you solve a real problem for them and they embrace you, it is the best feeling. Our shout out is Professor Vincent, Charles Vincent, and Dr. Jill Bailey at BOB.health. They have been unbelievably supportive of us, give us access. Mark and I, the co-founders, are actually honorary employees of the trust, and we go to meetings and get so much support from them. So thank you very much to the two of you. I love you both dearly. Thank you very much. And Rayna, for you, you've mentioned Kent, Surrey, Sussex had been quite helpful on your journey.
Yeah, definitely. I mean, all of the HSNs, I think, represent a huge step forward in encouraging the adoption of technology, and there's lots of different approaches that they're each using up and down the country. But particularly KSS, I think there's too many people to name, but people like Nuala Foley and Rob Berry, who are just tirelessly going above and beyond to help technology scale and really understand from the inside what the precise difficulties are, what concerns a procurement manager might have, and being able to anticipate those and address them head on is something that I think a lot of people couldn't do without these organisations. So we found them brilliantly helpful.
Amazing. And Rob actually spoke yesterday along with Hugh McAfee on a track. And Rob is someone who's also helped. Rob Berry at KSS is also someone who's really helped and supported Bob. So I do think great people and a great organisation. So if you can lock in with an HSN, that's going to be amazing. And Clíodhna may be able to tell us how we do that more effectively later on next year, because they're a key stakeholder in what she's doing with the innovation service. So Daf, do you just quickly, Jersey was an interesting one. Is it, if you come off mute, is it Health X is the name of the sandbox? Is that right?
Yeah, so HealthX. So there's the Allen Lab was kind of born out of work in VR in Jersey and the kind of role for that. There's a couple of interesting things in terms of Jersey's approach. Now, clearly they're on an island. They have a government of Jersey. They can do things a little bit differently, and there's a bit more flexibility to do that. But they also have to kind of manage interesting relationships around care across, onto the mainland, as it were. So they have relationships with the South Coast, with Oxford, different places. So, they've tried to be a couple of steps ahead in many ways in terms of the kind of remote journey, and in many ways they're kind of playing around with the VR stuff and to solve some of those problems quite early. But yeah, from our perspective, we've got a few examples like kind of the Chelsea and Imperial stories that we've talked about, but then Jersey felt quite different. It's quite noticeable. I went over to Jersey for a week in just before COVID. It was February or so, and we basically went from we'd be quite keen to do this to on Monday to Friday being like, yep, we're gonna actually do this. And there was kind of a meeting on the first floor with some clinicians, and then we kind of at the end of that meeting went up to the second floor and had some conversations with the manager, and then a couple of the managers went up another floor 5 minutes later and had a conversation with the Minister of Health, and it was kind of, yeah, okay, we're going to kind of do it. And it was like, oh, that's kind of weird. That's kind of a different approach. But yeah, so
amazing. Well,
sandbox stuff does work when there's the right people involved. Yeah,
that's amazing. So have a read of the story on the Bob platform, which is BOB.health. And I think everyone's going to be running to Jersey now as soon as they get allowed to get on a plane to go and see if they can get an implementation of secondary care. But Kerno sounds great as well, Kerno Health for primary care in Cornwall. Zain, just to let you know, someone has put a question in that says, can other regions take part? Can other people get involved?
Absolutely. Yeah, we can get involved, yes.
So,
contact us. Yeah, we've got a national network of therapists. Separately to the NHS, we're serving universities, helping their students in the UK and actually studying in Europe because they're in lockdown away from their families. We're serving charities and other organizations. So we've got a national network of therapists that are plugged into our platform that could be deployed anywhere.
Amazing. So hopefully, let's hope that this little session at Giant maybe helped you get a whole nother region in the bag. If you're the person who asked that question, Zain's email is in the chat. So ping him an email, tell him that you listened to him on Giant, and let's get the ball rolling for a whole nother region. So Zain, a top tip that you wish you'd known. So if I can just, in a minute, a top tip that you wish you'd known before you started your adoption journey, what would you like to, so therefore imparting a gem of knowledge to our audience?
I'll be honest, I would have loved to have known about this digital test bed sandbox stuff. I had no idea, you know, if you go back to me 18 months ago, I didn't know that existed. Obviously, investors generally don't know that kind of stuff exists. So I think I've found working with AHSNs can be very difficult. I've met lots of them, I'll be honest. I'm not saying don't work with AHSNs because everybody's product is different and their needs are different. But I think that's very important. I think also patience. You need to kiss a lot of frogs. You need to go. It's hard. NHS is not easy. You have to, as a startup, when you're starting, you know, at the beginning, you need to have an alternative strategy unless you've got something really, really super duper focused on NHS. Otherwise, you're just going to run out of money.
Yeah.
So that's the brutal reality, and what I tell a lot of medical students who seem to be contacting me on LinkedIn every day. You know, you're not going to get your product into the NHS tomorrow. You're going to have to travel. Me and Rachel, my co-founder, have been on a train to all kinds of places. So you need patience, you need determination, but also you need to be realistic. You need that data, like Dr. Lucy said, that proves what you do works. And 9 times out of 10, the only way you're going to go and do that is B2C. And going B2C initially means you need money.
That is a challenge. I think it's a side of what we're doing that people don't get. You can, if you like, because you're slogging away with your end users, but you're also trying to raise money, and it's a really interesting work. It's like a whole nother element of your job.
Yeah.
Other than just trying to get your product into the market. So
and you need to show it works.
Absolutely.
You can't come up with an idea. You've got to show it works.
Wonderful. Well, thank you very much, Zain, and I hope that you get your lead via chat. So, Rayna, how about you? What's the thing that you wish you'd known before you started?
All of the above. It takes time, it takes patience, it's slow. I think just to touch on one area of what we just mentioned, the evaluation and having the evidence, I think it's really cool, and you're never going to be able to scale in the NHS without that. But I think particular to that, something that we really have doubled down on the value of is getting the evaluation question right. There's all sorts of things that you can prove with any study. There are all sorts of things that you could argue have benefit to patients or to services or to clinicians, but aligning that evaluation question to what is the highest priority and not trying to prove too much, but really focusing on what is the absolute highest value add that you can prove with an evaluation study or with research. That's the thing that I think has been difficult and worth spending time on.
Amazing. Thank you for that insight. Thank you. So Daf, over to you. Remember to unmute your line so that we can hear you.
Yeah, again, kind of same as lots of the above. I just wanted to pick up a little bit more on the kind of collaboration piece. So I think, you know, framing that adoption approach around collaboration rather than sales, doubling down on those collaborative relationships, because, you know, we know that selling in healthcare is hard, but, you know, forging collaborations often actually in the end they have the similar or same commercial terms. You know, it feels much easier. It's so much more enjoyable. It's better for everyone's mental health. So, you know, work hard to find those that share the same passion for the problem you're tackling and solving, but they just happen to be sitting on the other side of the fence. You know, that they're within the healthcare organisation rather than you on the kind of side of industry. Double down on, you know, invest time in those relationships and collaborations. So if there are those listening to this who feel that they're in that kind of boat, get in touch. We'd love to help. We can help this winter. Do get in touch.
Amazing. So yeah, I mean, it is hugely important, and a question actually is sort of has come in, and I will come on to Paul in a sec, is talking about the fact that, you know, what if you've got like an innovation which no one's even ever heard of, so it's so innovative, people don't even know there's an unmet need. I mean, that is a huge challenge, because at the end of the day we're trying to solve a problem the NHS has with what we're doing. And obviously, if you have got something totally groundbreaking, and maybe I'll ask Clíodhna how someone with that type of innovation, where there is no current demand, how that fits in. So we'll ask her that. So I'll give her some time to think about it before as we come through with our other SMEs. So Paul, what do you wish you'd known at the start of this journey?
Top tip, yeah. So I suppose one thing that I regret is not recording a lot of the feedback information early on, and just be meticulous about recording those interactions. Whether it's with the patients or the therapists or anyone, and just getting that down. So I recommend doing that as a critical part of your process. Even when it's the early stages, even if it's a random conversation, make sure you get the permission even to say, do you mind if I record that as a bit of feedback, as a quote, etc., etc. Because once you build that base, as well as building this is how it works and the evidence base, the two together are exceptionally powerful. And I think that's led us to now really building our, for example, clinical advisory boards, really driving a term we have called Gripable therapists. So these are people that are sort of advocating or trained on the system. And actually, once you have that base of those individuals, it's less about talking to you. It's more about people networking and talking to each other. And that's how we're spreading the word. People are coming to us because they've spoken to someone who's interacted with it, because we've brought down certain barriers to adoption, as you said, trial first and those sort of things. But so yeah, those are my two things. Record everything because it really eventually does build a huge case, and then it allows for that sort of spreading of the word, as well as you build your sort of clinical advisory boards and a much wider network.
Amazing advice. I would just add to that as an SME, just to say, is when you do interview people and try to understand the customer needs, is just be super objective. I'm a comms man by training. I was a microbiologist, then a comms man. I'm really good at selling things to someone as opposed to being objective and actually listening to them. So I've had to learn that skill as an SME, is to really understand what the customer needs is, but not to push what you've got onto them, but really listen to what it is they need in that process. And I think recording it is really key. Thankfully, my co-founder Mark is really good at that kind of discipline, because that wouldn't be my style, but he is very good at it. Thank you, Mark. So Lucy, what's your top tip?
So I guess, our challenge has been rapidly trying to deploy some software products into a number of trusts over the last 6 months. There is a huge variance in clinical practice and business practice, actually, between the trusts, and one size does not fit all. And so I think it really pays to understand the clinical landscape and also to ensure what it is that the trust is trying to get out of using your technology. And so I think it's really trying to help the trust to understand that change management processes need to be put in place and thought about before the technology goes in. And then, as other speakers have said, then really picking out the core purpose of what that technology is hoping that trust is hoping it's going to do, and measure it. And it might be different for different trusts, because the clinical landscape and the way that they deliver care is different in different trusts. And so it really pays to spend a bit of time, or to encourage the trust to resource that change management, so that we can really maximize the benefits of digital technology.
Amazing. Thank you, Lucy. And then Victoria, what do you wish you'd known? Obviously, you've come from the NHS world into the commercial world, so probably there's lots of learnings for you. But what do you want to pass on?
So I think from my NHS experience, so I've talked to a lot of people about the fact that I was that procurement manager that wouldn't entertain people who would phone up with sales inquiries. I was the person that didn't have time to understand what people were trying to sell me. From being on that side to now being on this side, I think you're absolutely right, Neil. And it's something that I learned being on the other side, is listening. And it is about understanding. And when people are looking at technology, whilst they may have an ideal of how they want it to be, they don't necessarily understand how to get to that point. So just by listening to them and understanding, and again, like what you said, not promoting what you're doing, but understanding what they want to do and actually map it out with them so that you're working in an alignment rather than against each other, I think is probably the biggest thing to take away.
Amazing. Thank you for that, Victoria. That's fantastic. So just to say, we're heading to the end of our session. Jocelyn Aloma has submitted some good questions. She's saying SMEs are delivering brilliant solutions. So thank you, Jocelyn. Yes, we are. And I just wanted to, apparently she's flagged something, she's flagged to Zain and Rayna that they've got something that she could talk to you about. It's called Mynurva. So anyway, I'm going to ask her to email you. So Jocelyn, please email Zain and Rayna if you think that will be useful for them. And then there is a question, someone has commented around around AHSNs that they might not be the perfect solution, but the fact is the HSNs is just one of many stakeholders to enter the system. So HSNs aren't the be all and end all. They are hugely useful. And my reflection on HSNs is that they're all very different. So they're not all, they're called HSNs. There are 15 of them, but they're all structured and run in slightly different ways. So it might not just be based on geography. Some of them have different programs which might be more relevant. So don't take HSN's experience with one where you don't get through. It might not, there could be other ones to go through, but the innovation service might help solve all that. So I'm going to bring Clíodhna back in. So we've got about 4 or 5 minutes to your reflections on having heard this. You know, you've understood the landscape. Any reflections?
Well, I guess first of all, I'm going to apologize because I think I'm going to bore a lot of you because all the innovators have spoken quite a lot of truth, and I'm going to actually have to just echo them and a lot of what they've been sharing. I think that, you know, you also asked me to speak about a bit the truly groundbreaking innovations and what to do with them. I think I also want to respond to the comment about the NHSNs, and I think Etar Al-Ali's comment was about, you know, procurement actually route often being the thing that kills things off in the long run. And I mean, I don't feel like we have enough time to go into the detail, but there's definitely work as part of the innovation service about building that long view of what's coming down the innovation pipeline so that that forward planning for procurement can occur, so that things, they don't fall off a cliff edge at the end when they are now ready for entering supplier route. So I think that's one thing which we want to respond to quickly there. I think, you know, your question earlier about, you know, the truly groundbreaking innovations, and I think how they can best get into the NHS. I think, again, there's a lot of insight played back for the different SMEs about the best way to approach this. And I think my advice would be, you know, if you think you have something that's truly different and that's solving a need in a way that nothing else is, start testing that assumption as quickly as possible. Start testing that idea absolutely as fast as you can. With any support organization, with clinicians, with as many people who will listen to you. Because there are lots there of people on the ground who will be able to tell you, is this a genuine problem that needs to be solved? Like, they mightn't be able to say, you know, a digital or something or the other solution is what's needed, but they'll tell you if it actually needs to be solved or not, if it's a genuine problem. And they also have a sense of the appetite on the ground for such disruptive change or not for disruptive change and what that should be. And, you know, I think one of the most important things to keep in mind with innovation is that what's key is not just the innovation, the product or the service itself, but its fit with everything else that goes around it. And what's really important to do is to build that strategy then about, you know, tweaking it to be a little bit more a better fit for existing services. You know, we are not going to disrupt much, or actually going all the way to, yeah, we are going to disrupt a lot of things because there's appetite for that, because now is the right time for change. And work through that and present those options with your stakeholders in a collaborative way, rather than presenting to them, you need disruption and I have the solution, because that really will get a better fit for people's needs, and it really will enable much more effective working. And yes, I would agree with Dafydd about it's better for everybody's mental health and working relationships as well. And there are a number of different support organizations you will have seen in the slides earlier who can help you with a lot of that. But I think, you know, I want to just share, I think, 3 other reflections. The first is like the trickier, potentially more controversial one, which is about evidence, which everybody gets nervous about. But, you know, as everyone here has said on the call, it's absolutely critical. You know, you need to prove that it actually works. And I think my advice to most SMEs would be just to try and get to grips as quickly as possible with what evidence means, both for your innovation and also what types of evidence are looked for. Like, it will generally not just be it worked in a trial. It will also be something about, does this deliver the same benefits when it's actually used in practice with all of the messy, complicated things that happen in the NHS and at scale? And I think, you know, that's one of the real critical reasons we're developing the innovation service, to provide better clarity on this. And to really work through the detail about it. What is the key research question for your innovation? As Rayna said earlier. I think the second thing, which I'd really agree with, is collaboration mindset is key. You know, just pivoting away from that sales mindset into collaboration, and it'll open so many doors for you. You'll get so much more honest advice, and you'll also get so much such better social capital, to be honest. And I think it's great to hear about collaboration mindset, both with the NHS, but also I see innovators doing that really effectively with each other. And that's one thing that really impresses me about the health tech innovation community, about how willing they are to help each other, which is, I guess, linked to the intrinsic motivation, like, of why somebody goes into health tech innovation rather than innovation in a different sector. I think just the final point, which is again linked to that intrinsic motivation, you know, I think the whole rest of the team gets so much energy from speaking to innovators, because we see people who have intrinsic motivation, who don't care about doing something, but want to do something well for the benefit of patients, for the benefit of the NHS, and who have that real willingness to change, and willingness to change what they're doing to make sure, you know, it's going to help the doctors, the nurses, the ward clerks, everybody who's going to be using it, the GPs, the secretaries. And I think I'm always so impressed to hear just how holistic they are in thinking about stakeholders and how much they value the input of every stakeholder. And I would say also, who you listen to is absolutely critical. Listening to as wide a range of people, and in particular when there is then trade-offs between, you know, people with different power and status within a given service. And I'm really glad to hear so many people role modeling this appropriately on this call as well. And I think, yeah, for me, I think the future looks bright within health innovation when I hear people speaking in these ways, and it gets me very excited.
Well done. I did a little cough on mute earlier. So thank you so much, everybody, for listening in. Thank you to Zain, Rayna, Daf, Paul, Lucy, Victoria and Clíodhna for their amazing contributions. Everyone is doing amazing work, and we really do wish them all really well. So please reach out to them. Jocelyn, who I assigned the wrong gender. Jocelyn is in fact a gentleman, so you may well hear from Jocelyn, Zain and Rayna. And so, yeah, thank you so much. I mean, being an SME, being a startup and scale up is hard work. We kind of have to lean into it. You have to push and be patient, and that's something that Rayna said. You've got to realize that things are going to take time, so we've got to be patient and push through, but keep the faith, and we will deliver great things and solutions to patients. So thank you so much, everybody, for listening in, and thank you to our panel. So take care and enjoy the rest of the conference.